Good day everyone. We are here today to discuss about insulin, its function, and its importance. Not only that, we are also discussing about diabetes and other blood sugar conditions. So what are we waiting for? Let's start.
What is insulin? Insulin came from the Latin word insula, which means island. Insulin is a polypeptide hormone produced by B cells of Langerhans of pancreas. Yung insulin is a polypeptide with a molecular weight of 6,000 daltons, consisting of two amino acid chains, A and B, linked by two disulfide bridges. It has a significant impact on how proteins, fats, and carbohydrates are metabolized because pinipigilan nito ang hepatic glucose at triglyceride production, also yung adipose tissue lipolysis at whole body, at muscle proteolysis. Also, it stimulates glucose uptake in muscle. It is considered as the anabolic hormone, meaning that it is a tissue-growing hormone. It was the first hormone to be isolated, purified, and synthesized. Since the early 20th century, doctors have been able to isolate insulin and provide it in an injectable form to supplement the hormone for people who cannot produce it themselves or have increased insulin resistance. It was the first hormone to be sequenced by Frederick Sanger in 1949. Also, the first hormone to be created using recombinant DNA, which developed by Genentech and licensed by Eli Lilly and Company.
The major purpose of insulin is to regulate the body's energy supply by balancing micronutrient levels during the fed state. The release of insulin is tightly regulated in healthy people in order to balance food intake and the metabolic needs of the body. Insulin has many effects, but mainly it controls how the body uses carbohydrates found in certain types of food. Carbohydrates are broken down by the human body to produce a type of sugar called glucose.
What is diabetes? According to World Health Organization, diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the body can effectively use insulin it produces. Insulin is a hormone that regulates blood glucose. Diabetes is a chronic long-lasting health condition that affects how the body turns food into energy. And over time, this can cause serious health problems such as heart disease, vision loss, and kidney diseases. The number of people with diabetes rose from 108 million to 422 million in 2014, and the rising cases happens rapidly in low to middle income countries than in high income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. Amputation is the removal of part or multiple parts of lower limb. There are two types of diabetes, the type 1 and the type 2 diabetes. Type 1 diabetes, previously known as insulin-dependent juvenile or childhood to onset, is characterized by deficient insulin production and requires daily administration of insulin. In 2017, there were 9 million people with type 1 diabetes and majority of them live in high-income countries. Causes and means to prevent are still unknown, but some symptoms are excessive excretion of urine, thirst, constant hunger that may occur suddenly. The next one is type 2 diabetes, formerly called non-insulin dependent, result from body's ineffective use of insulin. More than 95% of people with diabetes have type 2 diabetes. It's sometimes the result of excess body weight and physical inactivity. Symptoms are somehow similar to those of type 1 but often less marked, so the disease may be diagnosed if complications have already shown. This type of diabetes now also occur frequently in children, not only in adults.
So, what is the importance of insulin in our body? The major purpose of insulin is to regulate the body's energy supply by balancing micronutrients levels during the fed state. Insulin is critical for transporting intracellular glucose to insulin-dependent cells, tissues such as liver, muscles, and adipose tissues. Why it is important for diabetes? Insulin helps blood sugar enter the body's cells so it can be used for energy. Insulin also signals the liver to store blood sugars for later use. Blood sugars enters cells and levels in the bloodstream decrease, signaling insulin to decrease too. So without this insulin, our body will break down its own fat and muscles, resulting in weight loss. This can also lead to a serious short-term condition called diabetic ketoacidosis. This is when the bloodstream becomes acidic and you will develop dangerous levels of ketones in your bloodstream and become severely dehydrated.
Glucagon tells the liver to release stored sugar. If your blood sugar gets too low, you can get hypoglycemia. This can make you feel dizzy or sluggish or even pass out. Glucagon can help with hypoglycemia so you feel right again. And when you have not eaten for several hours and your blood sugar level drops, you will stop producing insulin. GLP-1 or glucagon-like peptide 1 help pancreas to produce right amount of insulin to move sugar from the blood to the cells. When we eat, our blood sugar rises. GLP-1 gets to work right away by telling the pancreas to release the hormone insulin to keep blood sugar in balance.
So here's the causes of type 1 and type 2 diabetes. On type 1 diabetes, it occurs when your immune systems destroy cells in your pancreas that make insulin. The body systems for fighting infection attacks and destroys the insulin producing beta cells of the pancreas. So, on type 1 diabetes, it is usually caused by genes and environmental factors such as viruses that might trigger the disease. On type 2 diabetes, it develops when the pancreas makes less insulin than the body needs, and the body cells stop responding to insulin. They don't take in sugar as they should because sugar builds up in your blood. When cells don't respond to insulin, this is called insulin resistance. On type 2 diabetes, it is caused by our lifestyle factors including obesity and lack of exercise. It is also from our genetics or abnormal genes that prevent cells from working as they should.
These are the common signs and symptoms of diabetes. Urinate a lot, often at night. Very thirsty. Lose weight without trying. Very hungry. Blurry vision. Numb or tingling hands or feet. Feels very tired. Have very dry skin. Have sores that heal slowly. Have more infections than usual. These are the healthcare plan that you can do if you have diabetes. 1. Make a commitment to managing your diabetes. Learn all you can about diabetes. Make healthy eating and physical activity part of your daily routine. Maintain a healthy weight. Monitor your blood sugar and follow your healthcare provider's instruction for managing your blood sugar level. Take your medications as directed by your healthcare provider. 2. Don't smoke. Avoid smoking or quit smoking if you smoke. Smoking increases your risk of type 2 diabetes and the risk of various diabetes complications. Number 3. Keep your blood sugar and cholesterol under control. Like diabetes, high blood sugar can damage your blood vessels. High cholesterol is a concern too, since the resulting damage is often worse and the more rapid when you have diabetes. When these conditions team up, they can lead to a heart attack, stroke, or other life-threatening conditions. 4. Schedule regular physical and eye exams. Schedule 2 or 4 diabetes checkups a year, in addition to your yearly physical and routine eye exams. During the physical, your healthcare provider will ask about your nutrition and activity level and look for any diabetes related complications, including signs of kidney damage, nerve damage, and heart disease, as well as screen for other medical problems. He or she will also examine your feet or any issues that may need treatment. Your eye your eye care specialist will check for signs of retinal damage, cataracts, and glaucoma. Number 5. Keep your vaccines up to date. Diabetes increases your risk of getting certain illnesses. Routine vaccines can help prevent them. Number 6. Take care of your teeth. Diabetes may leave you to gum infections. Brush your teeth at least twice a day with a fluoride toothpaste. Floss your teeth once a day and schedule dental exams at least twice a year. Call your dentist if your gums bleed or look red or swollen. Number 7. Pay attention to your feet. High blood sugar can reduce blood flow and damage the nerves in your feet. Left untreated, cuts and blisters can lead to serious infections. Diabetes can lead to pain, tingling, or loss of sensation in your feet. Number 8. Consider a daily aspirin. If you have diabetes and other cardiovascular risk factors, such as smoking or high blood pressure, your doctor may recommend taking a low dose of aspirin every day to help reduce your risk of heart attack and stroke. If don't have additional cardiovascular risk factors, the risk of bleeding from aspirin use may outweigh any of its benefits. Ask your doctor whether daily aspirin therapy is appropriate for you, including which strength of aspirin would be best. Number 9. If you drink alcohol, do so responsibly. Alcohol can cause high or blood sugar, depending on how much you drink and whether you eat at the same time. If you choose to drink, do so only in moderation, which means no more than one drink a day for women and two drinks a day for men. Always drink with a meal or snack, and remember to include the calories from any alcohol you drink in your daily calorie count. Also, be aware that alcohol can lead to low blood sugar later, especially for people who use insulin. Number 10. Take stress seriously. If you're stressed, it's easy to neglect your usual diabetes care routine. To manage your stress, set limits, prioritize your tasks, learn relaxation techniques, get plenty of sleeps, and above all, stay positive. Diabetes care is within your control. If you're willing to do your part, diabetes won't stand in the way of an active, healthy life.
For our next topic is about hyperglycemia and hypoglycemia. We are going to tackle about the symptoms and signs of these two blood sugar. So number 1, hyperglycemia or high blood sugar. High blood sugar or hyperglycemia can affect people with type 1 diabetes and type 2 diabetes as well as pregnant women with gestational diabetes. It can occasionally affect people who don't have diabetes, but usually only people who are seriously ill, such as those who have recently had a stroke or heart attack or have a severe infection. Hyperglycemia shouldn't be confused with hypoglycemia, which is when a person's blood sugar level drops too low. So it is really important to be able to recognize and treat hyperglycemia, as it can lead to serious health problems if left untreated. Very high blood sugar levels can cause life-threatening complications such as number 1, diabetic ketoacidosis or DKA. It is a condition caused by the body needing to break down fat as a source of energy, which can lead to a diabetic coma. This tends to affect people with type 1 diabetes. Number 2, complication is hyperosmolar hyperglycemia state or HHS. It is a severe dehydration caused by the two body trying to get rid of excess sugar. This tends to affect people with type 2 diabetes. That is the little background about hyperglycemia or high blood sugar. And now I'm going to discuss about the symptoms of hyperglycemia. Number 1 symptom of hyperglycemia is increased thirst and a dry mouth, madalas na pagkauhaw at pagkakaroon ng tuyot na bibig. Number 2 is needing to pee frequently. Yung segundo at minuto mong nararamdaman na naiihi ka. Number 3 is tiredness, pagkaramdam ng pagod. Number 4 is blurred vision. Ito yung unti-unting pagkalabo ng iyong mga mata. Number 5 is unintentional weight loss. Hindi ka naman nagda-diet, hindi ka naman nag-exercise, pero kusang pumapayat ang iyong katawan. Unti-unting bumabawas ang timbang mo. Number 6 is recurrent infections such as thrush, bladder infections, and skin infections. These symptoms of hyperglycemia can also be due to undiagnosed diabetes. So, see your GP if this applies to you. You can have a test to check for the condition. Number 2, hypoglycemia or low blood sugar. It can change often during the day. At this level, you need to take action to bring it back up. Low blood sugar is especially common in people with type 1 diabetes. Knowing how to identify low blood sugar is important because it can be dangerous if it left untreated, just like the hyperglycemia. Read more about what causes low blood sugar and common symptoms. Now I'm going to discuss about the symptoms of hypoglycemia so you can gain more knowledge about the symptoms of hypoglycemia. How you react to low blood sugar may not be the same as how someone else with low blood sugar reacts. It's important to know your signs. Common symptoms may include number 1, fast heartbeat, number 2, shaking or panginginig, number 3, sweating or pagpapawis, number 4, nervousness or anxiety, number 5, irritability or confusion, and number 6, dizziness or pagkahilo. These are the symptoms of hypoglycemia. So now you know what are the differences and symptoms of hyperglycemia and hypoglycemia. If you think that you are experiencing one of those symptoms, don't hesitate to go on your general practitioner to have a consultation. And now let's go on to the next topic.
Preventing a low blood sugar level. If you have diabetes, you can reduce your chance of getting a low blood sugar level. If you check your blood sugar level regularly, be aware of symptoms of a low blood sugar level so you can treat it quickly. Use a continuous glucose meter, CGM, or flash monitor to see how your blood sugar level are changing. As your diabetes care team about getting a monitor. If you do not always have one, always carry sugary snack or drink with your sack as glucose tablet, a carton of fruit juice, or some sweet. If you have a glucagon injection kit, always keep it with you. Do not skip meals. Be careful with drinking alcohol. Do not drink large amounts. Check your blood sugar level regularly and eat carbohydrate snack afterwards. Be careful when exercise. Eating a carbohydrate snack before exercise can help to reduce the risk of hypo. If you take some type of diabetes medicine, your doctor may recommend you take a lower dose before or after doing intense exercise. Have a carbohydrate snack such as those if your blood sugar level drop to low while you asleep. Nocturnal hypokalemia. If you keep getting a low blood sugar level, talk to your diabetes care team about things you can do to help prevent it.
The importance of blood sugar test. Regular blood sugar testing is the most important thing you can do to manage type 1 or type 2 diabetes. You'll be able to see what makes your number go up or down, such as eating different food, taking your medicine, or being physically active. With this information, you can work with healthcare team to make decisions about your best diabetes care plan. This decision can help delay or prevent diabetes complications such as heart attack, stroke, kidney disease, blindness, and amputation. What is a blood sugar test? A blood sugar test is a procedure that measures the amount of sugar or glucose in your blood. People with type 1 and type 2 diabetes also use this test to manage their condition. Type 1 diabetes occurs when the cells in the body responsible for producing insulin are destroyed. Type 2 diabetes occurs when your body becomes resistant to insulin and no longer uses it effectively. Both types can result in high blood sugar if they are not managed well.
There are two terms you will hear when testing your blood glucose levels or blood sugar levels. The first test is the fasting blood glucose level test. This type of test measures your blood sugar after an overnight fast. In short, the patient is need to be fasted for at least 8 hours and then blood is collected. This also tells you how your body handled or maintained your blood glucose level during the fast. So the normal value for FFG or FVG is 5.6 millimoles per liter. That means the ratio of how many sugar you have on your body. Then if it exceeds, then you have prediabetes. Prediabetes is blood sugar level is high and appears for developing type 2 diabetes. The second test is the postprandial glucose test or PPGT. So this test is testing your blood sugar level taken 1 to 2 hours after you have eaten, which means that the patients need to have his lunch and then go for a blood test where the blood sugar level will be testing and see how your body responds to sugar and starch and tell you how high your blood glucose after eating. So the normal value of PPGT is 7.8 millimoles per liter. So the next test is A1C testing or HbA1c test or glycated hemoglobin A1c test. So this test measures your estimated average blood sugar level over the past 2 to 3 months. The HbA1c test is used to monitor blood sugar or blood glucose control over a period of time and also to diagnose diabetes. So majority of the doctors prescribe this test for non-diabetic patients because it gives a precise detection of blood sugar in our blood for the last 3 months. So it's like a memory blood sugar level because it shows you how well you're controlling your blood sugar levels over time. And it also shows if your blood sugar level is increasing or decreasing. The normal value of HbA1c test is 5.7%. That's equivalent to an average glucose level of 6.5 millimoles per liter. Diabetes Care Team will help you develop a diabetes management plan to help you stay healthy and prevent any diabetes-related complications. In short, they provide ongoing support to manage diabetes. They are in charge of handling glucose testing, prescribe diabetes care plan, assist the patient. They will also tell you what to do and what needs to be changed in your lifestyle. So your diabetes care team should come from a team put together by your doctor. The diabetes care team is comprised of nurse. Nurse gives ongoing education and helps coordinate your healthcare needs. Next one is the physician. Physician always there to make modification to your treatment. Next is the dietitian. Give ongoing support on your diet and food intake. The last one is the endocrinologist or endocrinologist. Provide expert advice on development of your diabetes management plan and help you manage your blood sugar.
So that's all for today. We are hoping that you learned something about insulin. Thank you for listening to our discussion. Goodbye.